All right, we are going to get rolling here. If anyone has any questions or comments, please feel free to use the chat feature. If you are on your computer or your phone, you'll see a little text box. Click that, and you can go ahead and submit your question or commentary in the chat, and we'll address it. And without further ado, we will kick it off with Steve Bishop. Steve, take it away, please.
Hello, everyone. Thanks for joining us. I'll be one of your presenters today, along with Madison. A little bit about myself. I've been in the industry about 26 years. After my degree in kinesiology, went on to another program, got certified to become a first assist in surgery. So spent 3 years on the clinical side, assisting orthopedic surgeons in the operating room, and then transitioned over to the business side and became a rep, a manager, and a distributor. Also was a corporate trainer, company trainer. Spent about 18 years on the business side. And then the last 5+ years, I've been teaching for the college. So glad to be here today. Madison, how about you?
All right. Hi, guys. My name is Madison. I went to medical sales college in 2018. I do have my undergraduate degree also in kinesiology. And I started in medical sales industry shortly after I graduated from medical sales college, also in 2018. I started as an associate, and I've worked my way through a couple of roles, and I am now a field sales trainer and a territory manager at Solventum, which is a wound care company, and I'm happy to be here. So I've been in the industry for about 7 years now, and I love it.
Perfect. I love it too.
Keeps you busy. It's a lot of fun.
No doubt. So today we're going to talk about the rewarding career in medical device sales, all the different types of degrees and all the different types of students that come into our program. They come from all different types of backgrounds, and their experiences are what we kind of take and give you as much of the clinical and technical foundation you need to go out there and sell your story and sell your experiences and your education and in your background. And so I know when you look at a lot of the different companies and what they're looking for, you know, you may think that you don't have what it takes to go and possibly interview for that job or possibly get that job. But today we're going to try to show you that the things that you've gone through in your life do and have prepared you for being a great candidate for these companies. And so we'll talk about that, and then we'll have some time for some Q&A and hopefully get into a deep discussion on what we have to offer. As far as why people want to get into this industry, I would assume most of you would check off probably all 3 of these boxes: personal, professional, and financial. It's one of the few jobs that you're going to be, or I should say even careers, where you're going to be proud of what you've done each day. You're going to be excited to go to bed on a Sunday night so you can wake up on a Monday morning to go and start your work week. You're going to work with some of the smartest people on the planet and some of the most innovative companies. And what you do really does accomplish something for the people that you help, which is amazing. As far as the day in the life, if you are a surgical rep, or you work with surgeons in the clinical or OR setting, a big part of your week is going to be spent doing that. You're going to be, the clinical expert when it comes to your product, your instrumentation, your technology, your implants, and you'll be educating, training, and guiding these surgeons along to take care of their patients. So a portion of your week is going to be spent in that type of setting, in a clinic or in an OR setting, a surgical setting. The rest of your week is going to be set up talking to your surgeons, all of your customers, to make sure that you're on the same page as them with the products and the technology that they need to take care of their patients, possibly looking at patients themselves, possibly looking at their x-rays or CT or MRI. And then also just the logistics part of it, making sure you've got all the inventory you need, all the picking up, the dropping off, the signing in, and the restocking to make sure that all of your accounts, all of your hospitals and surgery centers and clinics are fully stocked and ready for those upcoming cases each week. Busy, busy, busy. As far as the earning potential, I guess we can have Madison talk about this as well. But, for the most part, we're seeing most of our grads, most of the people that are entering this industry, you'll get some type of salary and then some type of benefits, possibly bonuses, possibly a small percentage of the overall territory business. There's two ways to go about getting into the industry. You have a W-2 where you're a direct employee for that company and you have benefits, medical, dental, vision, 401k match, life insurance, disability, that kind of stuff. And then you have the independent route working for a distributor where you won't get those benefits, but then you still hopefully will be getting a nice salary and probably some other little perks to kind of pick up that overhead. But the overall earning potential in that first 1 to 2 years as a associate or entry level is around 95,000. And then of course, once you get out of that entry level role and you get promoted, you get into some higher bonuses and commissions and things like that and profit sharing. And then as you work your way up into your career, you can either become a territory lead, or you can get into management or become a director or VP, but that's for way down the road. So you have a very exciting future ahead of you. Madison, is there anything that you wanted to talk about? I don't want to be talking the whole time.
No, you're good. This is a great chart that you have here, and from what I've seen in the field, it's very accurate, and with my colleagues. And the longer that you spend in this career, the more you're going to make. Every year, it's going to be more and more rewarding. And the nice thing about medical sales is the more that you show up, the more you're going to get paid. The better you do your job, the more patients' lives that you touch, the more surgeons that you work with, you're going to see that reflected in your paycheck and in your salary. There's other companies that also have car incentives if your territory does require a lot of driving. A lot of companies will give a fleet vehicle, or other companies will give wear and tear and give you a gas card. Every company is set up a little bit differently, but there are other benefits in addition to even just the salary that you see, whether it's a work phone, a work computer, things like that also come into that pay. That's additional benefits outside of just your paycheck as well.
That's great. Yes, and these are things that that we definitely want to focus on as well, is making sure that when you do accept that contract, that everything that's in there is going to provide you with a nice lifestyle. I don't expect our grads to make a ton of money the first 1 to 2 years while you're training and soaking up all that knowledge. But if you are going to be using your own car, you should have a car allowance or a gas card. And if you're using your own cell phone. So yeah, these are all things, nice little perks that should be thrown in there to make it a worthwhile transition into this industry. Thank you. And that was awesome. As far as the degrees and backgrounds, that we've seen in this industry, yes, quite a few are coming in with some type of clinical background or science background, which is wonderful because it gives you a little more of that clinical background and side of it. You understand anatomy, physiology, and biomechanics and things like that. We're still going to cover that during our program, but it's a little easier transition. Someone that was thinking about pre-med or nursing or something in these sciences. And of course, that offers a great story of what you've gone through. Obviously very challenging degrees as well. And they do pair well with this clinical industry. Anyone with a business background is also a huge asset for these companies. I mean, this is a business mindset. This is a sales, probably one of, if not the most competitive, high-level sales industries that you'll ever get into. And so anyone with any type of business background in college or experience in the business world comes in very, very nice, because you have that mindset of growth and understanding your customer and being able to really provide, some kind of value.
I'll piggyback off of that. A lot of people have asked me, I don't have a background in the health industry, and I don't know anything about anatomy. Don't let that deter you away. I took kinesiology in college, but if you were to ask me some of my anatomy questions, I could not answer that for you. But when you go through the training in medical sales college, and when you go through the training with whatever company you end up with, they will teach you everything that you need to know. There's studying that you have to do on your own, but not knowing anatomy shouldn't be a reason to not go into the industry. If you're interested, you can always learn that. And being an expert in your field, you don't need to know everything. You just need to know, where your lane is and what your product does and what procedures you're in.
Yeah, absolutely. I mean, anyone can be taught the information. Matter of, and kind of what Madison said earlier, if you put in that extra time, if you put in a little extra effort, and you're fully dedicated and you're willing to learn, you'll be fine. I mean, honestly, it doesn't take much to be successful in this life, and especially in this industry. It just takes a little extra effort. And it's what separates somebody that does a good job to someone that does a great job. And so, I mean, anyone that doesn't have a clinical background or has, that is worried about learning the anatomy and physiology and biomechanics, you will absorb it. By the time that you leave our program, you'll feel pretty comfortable about what you know. And then whatever company that you go work with, whatever specialty that you get into, they'll give you that specialized training, and you'll feel, I would imagine, pretty comfortable or extremely comfortable by the end of that one, first to second year mark.
Certainly. I agree.
All right. What else we can talk about? So there are a bunch of other majors and a bunch of other types of students that we do get into our program that have been extremely successful, that don't have the business background or don't have that medical or clinical background. Communication, psychology, anyone with a athletic or sports science background, engineering. Obviously, a lot of the surgeons are engineers. So anyone that really understands people, how to build relationships, understands hard work or dedication or commitment. I mean, these are all great backgrounds to have. These paired with your life experiences usually make a nice little talking points, and give you those stories to really answer all the questions that you're going to get asked in these interviews, to really talk about what you've gone through in your life, what you've overcome, what you've succeeded in, what you've accomplished, and what you've learned.
I think you nailed it.
Yeah. Okay.
Yeah, you nailed that.
So as far as the extracurricular, this is another thing. Think about what defines you as a person. What separates you? Why are you special? Your mommy tells you you're special, but I want to hear you tell me, what is so unique about you? Why would I hire you out of the 500 applicants I've got? What have you done in your life that shows me that you're good at organizational skills, time management, problem solving, analytical thinking? Are you a hard worker? Anyone can say these things. Anyone can write it down, but I need stories to back it up. So think about the things that you've done in your life that really separate you from the other people next to you that might be applying for the same role. Any organizations that you've been a part of, volunteer work, government roles, any high-level athletics, any associations or internships that you are proud of and that really define you as the kind of person that you are. Okay, so think about all the things that you've gone through in your life. And we're talking, going back from childhood all through school, through high school and college, and whatever else you've done in your life. There's got to be at least 2 or 3 or 4 things that really make you unique and separate you from the average candidates. So think about those kind of stories, okay? Madison, anything you want to talk about with that?
The more you can do in school and even beyond school, the better. Any time management is huge in this industry. And if you can show that you were a part of, athletics, clubs, volunteer work, and you're able to balance that with your school, your work life, your personal life, and have that happy medium and those stories to go along with it. What have you done out on your own without somebody holding your hand? What changes have you made and in leadership that you've taken on in these individual organizations? Those are big stories that you can show that medical sales, it's a self-driven industry. No one's going to wake you up in the morning to go to work, and no one's going to be watching you all day, every day. So it's important to show that you're a self-starter and that you're able to balance all of these things, because it is a big balancing act.
Very well said. No, absolutely. You're not going to get micromanaged like you do in a lot of other industries. You're going to have a lot of freedom in this, in these roles, and they expect you to be able to fill in some of those gaps with, providing the most value that you can for that company or for that team. And so showcasing what you've done in your life, all the things you've accomplished, and how many things that you can do multitasking at a high level is another nice talking point. So, a lot of our grads, may not be able to check off all the boxes on that job description or those job qualifications, but they've got a lot of other things that they can bring to the table that are going to bring value. All right, what's the next slide? All right. So as far as, getting yourself ready, I mean, obviously, I always think of this job as not really a sales job. I think of it as a clinical role with a sales aspect. You have to be clinically sound. These surgeons are not just going to want to use your product because it's a great product. They want to be, they want it to be proven. Okay. And they want the person that they're working with to be able to speak their language. So being able to have those clinical, technical discussions with your surgeons is vital. Okay. To talk the language that is, what they believe in. And they want to believe that you believe in your product and that your product is going to be their best option for their patients. Okay. Because this is their practice. They want to do what's right. And they want to have their patients have great outcomes and high satisfaction, and hopefully recommend everyone else to come into their practice and build up their business. So the clinical technical side of it is a big part of the industry. Of course, learning about business and sales is another big part of it, building relationships, being able to handle a very fast-paced industry. You're going to have to get very good at analytical thinking and problem solving and adapting. You're never going to have the same day twice. Probably a big reason why a lot of our grads love this industry. You're not working at a cubicle 9 to 5, going and punching a time card every day. You're actually waking up, doing something brand new, challenging yourself, which is fun. It's exciting to be able to push yourself and to be, truly, excited and proud of what you're able to accomplish each day. Obviously, it's a very competitive industry. We're looking for people that not only are able to succeed at a high level, but people that also are going to be able to mentor and teach and train and lead at some point of your career. And of course, we want everyone with a service mindset. You're going to have the opportunity to make a very good living, but at the end of the day, the reason why we do this is to truly give back and to be there for our patients and to try to get our healthcare system from a good to a great place. And of course, drive technology as well. Madison, what do you have to say about that?
I'll say, so going to the technical and clinical knowledge bullet point, from piggybacking off of what you said, the reason that I love this career so much is we are selling a product, but I don't look at it that way. We're selling a solution, and we're helping the whole healthcare team. And in the end, the patient is the person that gets to benefit. It's the surgeon, the OR staff, wound care nurses, floor nurses. It's helping everybody either save time, a new product with a new FDA indication, or something that can help reduce a patient's risk of infection, something that can make something a little bit easier for the team in the OR. Finding those selling features and benefits is my favorite part, because you just show why your product is so great, and in the end, the patient is the one that gets to benefit. And I always put myself or my family members in the patient's shoe, and you really know that you are helping somebody at the end of the day, which is phenomenal. But we're helping more than one person. We're helping the whole team, the clinical side before the patient is even having the product placed on them. And selling solutions is so important, but getting trust is hard to build and easy to lose. So knowing your product inside and out, never guessing when you're out in the field. Getting surgeons trust is one of the hardest parts of this industry, and knowing your product inside and out, because they'll know if you don't know your product. And so it's very important that you're confident, you study, and you know your products and your competitors' products inside and out, because there is a lot of competition, and having tough skin is important, but being quick and selling your product and knowing that it's the best for that patient, that's how you're going to build the trust and maintain the trust.
Very well said. I agree with everything you said. No doubt about it. You got to know your competition. You got to know your product. You are the expert, and you're having a surgeon that spent a long time getting educated. They know a ton about, what they're doing and about your product, but they don't know as much clinically or technically. And that's where you come in and you offer them advice and guidance, and it makes a big difference. Excuse me.
That's me.
Look at you, rock star.
So I'll talk a little bit about how I transitioned out from medical sales college into the industry. And I won't sugarcoat it. It was a very tough transition, a lot of rejection in the beginning, but that's what shapes us as people. And it was quite a few interviews, but I was picky. And you have to be picky, because my greatest advice I could give is go with a product that you would want to use on yourself or your family member, something that you truly believe in and you know that you can be passionate about. Don't cut any corners, because the job is so much better when you love your product and when you truly believe in it and you know that it's going to work and it's going to help patients. So I graduated with my bachelor's in kinesiology from University of Illinois. And 6 weeks after I graduated, I went to medical sales college. I didn't want to waste any time. I knew I wanted to get into the industry, and I'm sure I'm in the same boat as some people on this call, where I had no sales experience. I didn't even know really what medical device sales was. I was bartending, and one of my regulars had told me about it, and I thought I wanted to do physical therapy at the time, but it just was not as fast-paced as I liked. When I was doing my shadowing in physical therapy, I asked the PT about medical sales from the customer that I was talking to, and he actually hooked me up with a rep that was at that hospital. I got to shadow him for a few days, and I just fell in love with it. Every day is different, and you are driving, you're going from hospital to hospital, OR case to OR case. You could be at a lunch and get a call that you got to run to the other side of your territory. I loved the organized chaos, and I loved that you had complete control. So I applied to medical sales college, got in, and medical sales college helped me tremendously because, as I said, I only had a few days of shadowing, but I knew I loved it, and I learned the anatomy. I learned how to sell products. I learned how to do an in-service. I learned how etiquette in the OR. That was huge. And I truly learned, what it took to be in this industry. And it gave me that foundation that I needed to go off and interview. And it gave me that experience that a lot of employers were looking for. When I was interviewing, they said, well, you don't have your 2 years of sales experience. Well, how do I get my 2 years of sales experience to get the entry level position? It's very tough. And medical sales college really helped me bridge that gap, showing that I invested in myself. I've invested in this career. I'm committed to this career. And I took the spine program, but I ended up in wound care, and I love it. But it gave me that true foundation to transition over. Lots of interviews, and I started as an associate with formerly known as KCI, which we are now Solventum. And the only constant thing in this industry is change. I started as an associate. I was an associate for 10 months, and then I got promoted to a representative role, and that was focused on the outpatient setting. So you don't have to be in the hospital to be in medical device sales. I was calling on wound care centers, home health agencies, physician offices, surgery centers, and I really enjoyed that. I did that for 1.5 years, and then I transitioned into a territory manager role, which is now more acute focused. All the same products, but now I'm more in the OR, in the hospitals, seeing patients in surgeon offices, working with the wound care team. And my role is very highly education focused. So for example, this morning I got up at 3:30 and I was doing night shift education. Every day is very different, but I truly love that about this job. I could not sit in the cubicle from 9 to 5, as Steve said earlier, and that's why this job is perfect for me. So that's kind of how I've transitioned and where I'm at now.
That's awesome. That's a heck of a story. I mean, a lot of growth for sure, and changes, which, you have to get used to changes, and hopefully you guys realize that, when we change is when we really grow as humans. So change is not bad, and usually your body has a way of telling you when it's time to make a change. So, and just because our program is heavy on orthopedics, and I know that, for Madison, she went through our spine program, we open the door to every industry that you can think about. So if you're thinking about cardiac, or you're thinking about endoscopy or urology or craniomaxillofacial or dental, you're going to get a little bit of everything. And it really opens the door to whatever avenue that you want to take. And it's not just surgical, it can be non-surgical. It could be capital equipment or disposables or laboratory or, durable medical equipment. So you have a lot of ways to go. As far as how we help, whatever background you had, whatever education, whatever experience you had, we're going to try to fill in the gaps. If you had a clinical background or a science background, then we're going to give you a lot more on the business and sales, business planning. I mean, really anything that we can throw at you to really help with that. Okay, so we know you've got that science background, but now I'm going to give you the business background. How do you go about understanding your territory, understanding your surgeons, understanding the companies and the products, and how to build sales strategies around that? Okay, so if you do have a business background, then we're going to focus a lot more probably on the anatomy and vocabulary and the technology behind it and some of the procedures that we're going to have to learn about to be able to speak that language that the surgeons are going to want you to know. And so, we'll do everything we can. Of course, we do like a lot of hands-on workshops. We do like to do a lot of role plays, sawbone labs and virtual reality stations and sales role plays and product presentations, because we want to get you as close to the real world setting as we possibly can. So when you get out there and you start interviewing, you're going to understand what those managers and companies are looking for. And then when you get out there into the market, you'll be able to talk to your surgeons on that level. So our top hiring companies are the ones you probably have heard of, but we work with thousands of managers and hundreds, if not thousands, of companies that are in this space. The company that Madison works for, you might not have heard of, but it's a phenomenal company with phenomenal products. I mean, a world leader in the wound care industry. But obviously, our biggest companies that do hire our grads are those big Fortune 500, the big ones you've heard of that are in that cardiac and ortho and surgical space. But there are thousands of companies in this industry, and I want you to really think about all the different cultures and really keep your mind open when it comes to where you might want to end up at. And I know that Madison was patient. She took her time to find the right spot for her. All right, that concludes our little presentation. Hopefully you guys have some questions that you can fire off using our chat feature. And Madison and myself would be more than happy to get into a deeper discussion with you. Don't be afraid. This is a totally free space. No judgment. And if you guys do want to chat, there's a little chat box on the bottom right-hand side. It looks like a little tiny script or a little notepad. Just click on it and type in anything you want to. Madison, anything else that you want to talk about?
Well, we can talk about a day in the life of a rep. Well, we have.
Yeah, why don't you tell us?
Questions.
In the life.
Every day is a little different. So for example, today I had to go to the hospital at 4 a.m. and I drove 45 minutes to get to this hospital. But the nice thing about medical sales is you are at the mercy of your surgeon's schedule sometimes, depending on what role you go into and what specialty. But I enjoy it because I do have flexibility of making my own schedule, especially when it comes to education in the hospitals. So I'll work with the education team to see what days work best for them and what days I know maybe I don't have a trial going on, or if I have education at another hospital or a big initiative or a scheduled OR case, then I can kind of work around those schedules. But while I was doing education at one hospital, I got a call that I had a patient on the table at another hospital. So I had to run up to another hospital, help with a case, and then went back to the original hospital. And now I have to go to another meeting at 2:00 with value analysis at a separate hospital. So today I'll be going to a total of 3 facilities. One was not planned, but that's the beauty and the fun about this role, is that you're constantly going. And if you're somebody that it's hard to sit down and hard to sit in front of a computer all day, this position is phenomenal. Some days I am doing lunches. Some days I'm in the OR all day. It is a lot of driving, though. On average, I drive about 100 miles per day. But every territory is going to be different. But when you're driving, a lot of times you're on conference calls, you're listening to webinars, you're doing your own personal education. I like to listen to audiobooks. It is a lot of driving. It is a lot of alone time. When you are out in the field, sometimes it can get a little lonely, but you're also constantly talking to customers. So it is an individual role, but also part of a big team. We work with post-acute. We have clinical educators also. And so every day is just a little bit different, but you do have the ability to make your own schedule, because nobody is going to tell you, Madison, this is what you're doing today. Madison, this is what you're doing next week. I am the one that's going out and scheduling all those with the customers. And the more you're out in the field, the more you're going to get your face out there, the more people are going to know your products. And it's truly getting out there is the best thing that you can do, meeting your customers.
Very well said, Madison. Awesome. All right. I don't see any questions in the chat box.
Steve, this is Michael. Yeah, it looks like a quiet group, but just want to let everyone know that we will be sharing a recording of this webinar as follow-up. So if you want to revisit anything we discussed today, or of course share it with anyone in your network, please feel free to do that. I would also encourage you to follow Medical Sales College on our socials, and hopefully Steve and Madison, you don't mind, but feel free to connect with them on LinkedIn as well. They'd be happy to help build your network and answer any questions. Yeah, follow us for future webinars and different tips and tricks and advice for launching your career in this industry. And thank you all for attending. Steve, I'll throw it to you for any closing remarks.
No, that was great. I mean, we have 4,500 grads in the marketplace like Madison. I mean, not rock stars like Madison, all of them, but I mean, there's thousands of our grads that are out there. It's a great alumni pool to reach out to and pick their brains and find out, is this program the way to go? And do they like the industry? Do they like their career path? And so feel free to reach out to them. Most of our grads, if not all of them, are more than willing to give back and help you. So don't be a stranger. Excellent job, Madison.
Oh, thank you. Thank you for having me.
Yeah. All right. Is that all we got for today?
Thank you all for attending, and we will see you in your email inboxes. Thank you, Steve and Madison.
Yeah.
Thank you.
Take care, guys. Have a great day.